Hi guys, welcome to another episode of the Cure for Your HIV. It's amazing having you back here on this platform. Yes, my name is Maria Moses, and of course, I'm very passionate about your health. I mean, I'm passionate about the health and lifestyle of people, and of course, it's especially with people with HIV and AIDS. And I am a public health practitioner. I work to support change so that people can have the knowledge to make, informed choices and, of course, take control of their sexual health and then have a general healthy lifestyle. Okay, and of course, this is in support of the global effort to end AIDS and achieve a sustainable developmental goal with regards to health worldwide. So, I'm so excited having you back here on this platform. All right, now if you are looking for testing, you're looking for latest on testing, you want to access care and treatment, or probably you want to know, some honest advice. You want to undergo some counseling about, sex and relationship. Okay, you're here in the right channel. Okay, you are in the right channel. Or possibly, if you want to know more information about other sexually transmitted diseases related to HIV and AIDS, then you are right in the right channel. You will find all of this and even a lot more here in this channel. So don't forget, kindly subscribe to my YouTube channel, hit the notification bell for further updates. I'm very excited to have you back on this amazing platform. Okay, and today we shall be talking about something very, very important, something very, very educative. All right, these are some of the questions bothering people's mind. Most people keep asking, are people with HIV at higher risk for COVID-19? Yes, they are. How do the social determinants of health and their relationship to HIV affect COVID-19? Very terrible. Okay, very high. And then what do we know about COVID-19 vaccine and HIV? Then what role is the federal government playing in addressing COVID-19 among people with HIV worldwide? Well, as we continue, we'll get some of our answers. Now, in my previous video, I talked about what COVID-19 itself is and what HIV is. So to brush us through, this COVID-19 was actually discovered in Wuhan community in China, that is in December 2019, and has, it has been spread around the world. Okay, it has been spread around the world. It's a virus that has a rapid spread, around the world. Now, this virus is actually is a new infectious disease that is caused by previously unknown virus, which was called SARS-CoV-2. Now, the virus is part of the family of coronavirus, which are responsible for lots of different illness, from the common cold that to the flu that But this new strain is, can be more and very more severe in some people. All right. So now, what are the common symptoms of this COVID-19? Okay, so the main symptoms of this COVID-19 that I'm going to be talking about here is fever. Okay, you could have dry cough, and then tiredness, and then you have loss of taste or smell. Okay, so in severe cases, people have difficulty in breathing. Some people experience other flu-like symptoms, including nasal congestion, conjunctivitis, and you have red eyes, which include red eyes, and then you have a sore throat also, and then headache, muscle pain, and also some people experience joint pain, skin rashes, nausea, diarrhea, chill and dizziness too are associated with chronic infection of COVID-19, and these symptoms can be managed at home actually. But you know what? Not everybody who has COVID-19 will have these actual symptoms and also will be able to manage it in their house. So you can still pass COVID-19 on, even if you don't have the symptoms, you can still have it. Now, that's why it's very important to follow advice to stop the virus from spreading. All right. Okay. Now, another thing I would quickly talk about is, in some cases, people will become, more seriously ill with COVID-19 with severe symptoms of shortness in breath. I talked about that. But that's okay. Just as if, if you had ever experienced a person who has, asthma, how he feels or how the pain is, the difficulty in breathing is. So somebody with COVID-19 could have such experience, and loss of speech or mobility. There could also be confusion, chest pain, or high temperature. So if you experience any of these symptoms, it is important for you to seek medical advice. Go straight away, and in critical cases, this COVID-19 actually can lead to death. Now, like I said, today we'll be talking about something very important. We'll be talking about similarities between HIV and COVID-19. Now, under this, I'll be talking about the fear in the population. Okay, existence of animal reservoirs. These two viruses share share this. Now, there is also increased synthesis of pro-inflammatory cytokines associated with these two viruses, and modification of intestinal microbiota too are associated. Then we'll talk briefly about neutrophils and extracellular trap formation, which happen. These are actually some of the similarities these two viruses actually share. Now, though some people may say this virus does not share any similarities, but let me tell you, from what I've told you initially, if you look at it critically, you will see that most of the symptoms a person with HIV is having is what the person with COVID-19 is having. Okay, so if you look at, I made mention of them, that's why I took my time to list them for you. Now, coming back to these similarities, we're talking about fear in the population. Now, HIV can affect anyone, okay, independent of their social status, race, color, gender, and what have you. Now, this can also affect people psychologically, and making them to feel afraid. Okay, fear. And what is fear? Fear is just false experience appearing real. Okay, and then they could have stress, anxiety, and apart from those factors in COVID-19, there are others that can make people feel like that the virus is new. There are not known effective antivirals for it, and also could make people to feel that this disease is more contagious than expected. So, and then they feel it can even severely affect young individuals with no previous pathologies, and also it can cause respiratory failure, and then forces hospitalization for many days. So these are some of the fears people really encountered. We don't want to be in the hospital for so many days. We don't want to stay in the hospital. But then, in addition, the panic is even increased by the presence of internet, over information, spreading of unfounded rumors, and there is hyperconnectivity hyperconnectivity, which actually make a lot of people to be so scared, and even stigmatization has made a lot of people to hide. I wouldn't want to go for COVID-19 test, which actually happens to the same way with people with HIV. Now, I also talk about existence of animal reservoirs. Now, This existence of natural animal reservoirs is, another common similarities, although they are found in different animals. Which, what I'm saying is this: the COVID-19 and the HIV virus are actually found in animals, but they are two different animals. Okay, the other one is being non-human primate in the case of HIV now, and then bat in the case of SARS-CoV-2. Okay, so these are the two. The other one is in terms of animal, primate animal, and this one is in the COVID has to do with bat. Okay, so the both of them are from animals. So another thing I want to talk about quickly is the increased synthesis of pro-inflammatory cytokines. So both viruses actually generate an increase in the production of cytokines, and this is linked to viral load in the case of SARS-CoV-2, and then these cytokines are related with secondary complications in infected people, those infections that I've mentioned to you earlier. So it is well known that HIV infection, the cytokines release is a chronic mechanism that generates prolonged inflammation, and of course sustained inflammation. Yes, it causes prolonged inflammation, and sustained inflammatory status has been actually related with increased intestinal permeability and bacterial translocation, which is detected actually in HIV infected patients. So the intestinal permeability, or let me say bacterial translocation or systemic inflammation, cannot be reversed with antiretroviral therapy. Okay, so residual viral replication and other co-infections also contribute to prolonged inflammatory status in this case. Okay, that has to do with HIV. And then the serum level of pro-inflammatory interleukins, which are which has been independently associated with morbidity challenges causing cardiovascular diseases and cancers, etc. And of course, in patients with controlled HIV replication, of course this wouldn't happen. Now, why for the COVID-19, the cytokine secretion is an acute response, and of course is implicated in the clinical manifestation of this patient. So basically, anyways, what I want to talk about is, I don't want to go deep into that. I just want to talk about briefly is that both of them have increased synthesis pro-inflammatory cytokines. So if you want to know more, you can just drop a message on my comment section, or probably message me on my through my email, and I will be there to answer your question. Now, I'll also talk about modification of the intestinal microbiota. So of course this has been proven that patients infected with SARS-CoV-2 who develop cardiac complications have higher levels of intestinal permeability and activation of these inflammasomes. Okay, of course, and then this is what causes it suggests that it leads to a heart intestine axis COVID-19 challenge. So in fact, one of the vaccine being developed is generally modified probiotic with a plasmid. The probiotic has a plasmid that contains the DNA of the SARS-CoV-2 protein. So HIV infection actually has an unfavorable effect on the interaction between many things. So so that's basically what I could say there. Has unfavorable effects on the interaction between the commensal microbiota and the immune system. To know more about this, just message me on my on my email, and I will be there to give you further explanation on that. But however, the both of them have the issue that has to do with they can modify the intestinal microbiota of the system. So I'll also talk about the neutrophils, extracellular traps formation. Briefly, the two viruses share mechanism known as this mechanism I'm talking about. That is the neutrophils extracellular trap formation. Now, this is a neutrophil death mechanism, which the neutrophils release net chromosomes and releases net chromatin fiber into extracellular space. So this neutrophil extracellular trap formation contain histones, microbicidal peptides, or even you can say oxidizing agents. So that's just the simple or common similarities associated with this virus, these two viruses. So what are the key points we're talking about here? Of course, these are difficult times for all of us. The world, the UNAIDS is actually working so hard to ensure that a lot of people, this particular issue is being taken care of. And then we know how COVID-19 happens to be very serious. It's a very serious burden for all the country worldwide. And of course, there are many things you need to put into consideration for you to at least prevent the initial infection. Which is, of course, we know about that. Just your personal hygiene, okay? That you need to, undergo. Here they are listed: avoid touching your eyes, nose, and mouth, and the likes of that. And then so on and so forth. Make sure that you and the people around you follow good respiratory hygiene. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze, and dispose of the used tissue immediately. Stay home if you feel unwell. Yes, if you feel unwell, please stay home. All right, so this bottom line is that based on the WHO's coronavirus 19 dashboard, there have been over 200 million confirmed COVID-19 cases, including over 4 million deaths due to the disease. Okay, so meanwhile, since the beginning of HIV pandemic, there has been almost 80 million cases, and this is from trusted source of HIV infections. And of this, we have nearly 37 million of people have died from AIDS-related infection, notably. So considering, looking at the two statistics, this is to tell that a lot of people are actually giving up the ghost due to COVID-19 because it was so rapid and rampant as at that period. And while a lot of people died, but as at COVID today, a lot of people are on therapy. All right, guys, I will be wrapping up here, and I'm so glad that you stayed tuned and you enjoyed the educative aspect. So let's join our hands actually to fight HIV and AIDS in our world. The basic thing is, the goal is to ensure that HIV awareness is created all over the world, and a lot of people happens to know what to do to come out or to be free from this HIV infection. And peradventure they're positive, then the goal is to ensure that a lot of people happen to stay healthy and live a better life to fulfill their destinies or their desired ambition. All right, guys, so I will be wrapping here, like I said, and I would like to see you in my next video where I'll be talking about further important stuff. I'll be talking about very important topic that I'd like you to stay tuned. That's why you should kindly subscribe to the YouTube channel and hit the notification bell for further updates. You can as well share this link to your loved ones so that they will also be in the loop to knowing what to do about HIV, and also to keep the people around them protected from HIV and AIDS and other related diseases associated with this particular issue we're talking about. So don't forget, we are still on the journey of how to access cure for HIV. So that's why you need to stay tuned. All right, see you guys. Thank you for watching, and see you in my next video. Bye.